Well, a potential bright spot in the battle against childhood obesity, a new study suggests obesity rates among young children in low-income homes have dipped for the first time in 3 decades. According to the Centers for Disease Control and Prevention, the rate began dropping 8 or 9 years ago and by 2010 had fallen below 15%. And while the drop was comparatively small, researchers say it's the first national study to show the obesity rate may be on the decline after tripling over the last 30 years. With us now, primary care physician Dr. Keri Peterson. Doctor, good to see you. Are you encouraged by this?
I am encouraged. Even though it's only a modest decrease, at least we're taking a turn in the right direction. And it was a very, very large study. It looked at 27 million preschoolers between ages 2 and 4. And what they found over a time period between 1998 and 2010, initially we saw about a 13% obesity rate. And that peaked in 2003 at 15.2%. But in 2010, when the study was concluded, we have turned the corner and now we are down to 14.9%. So it is an exciting turnaround.
Yeah, I mean it is, and I hate to bring the mood in the room down here, but it just seems kind of like a drop in the bucket because the problem is just so bad across the country.
I do agree with you. It is such a modest decrease. And when you do look at obesity numbers over the past 30 years, just in 2008, children between ages 6 and 11, 1/3 of them were overweight or were obese. But I think the important thing is that there is attention being drawn to the problem, and that because of that, there's a rising awareness in the part of parents and of communities and of child care centers that physical activity is much more important for children and that eating patterns need to change, including what's served in schools for lunch, for example.
Yeah, in schools for lunch, and you know, you look at these fast food places, doctor, and I mean, come on, you can get 2,000 calories now for $3. It's so easily accessible, and the less money you have, the worse the food gets. I mean, what's the biggest problem we face?
The biggest problem with children, I think with low-income families, it's the cost of healthy food. Organic foods, fruits and vegetables are expensive, and food from a supermarket or a fast food restaurant or even through this food stamp program are not necessarily the most healthy choices, which is why states and communities are now targeting child care centers. And there's even a movement and an impetus for the food stamp program to not only focus on food quantity, but also on food quality, because the access to healthy foods is a big problem.
And I gotta go, but you know what I see in these kids that are carrying too much weight is their esteem levels, doctor, are just so low.
Well, that's the problem. The short-term problem with children is self-esteem. There is a stigma. Psychologically, it can impact them. Not to mention it increases their risk for high blood pressure and high cholesterol, and they're more likely to be obese adults with all the problems that come with that.
Yeah. Dr. Keri Peterson, doctor, thank you.
Thank you, Trace.